with Congressman Bera. He is a Democratic member of the House Foreign Affairs Committee and is a medical doctor. Good to see you, Congressman. So you chaired hearings on Wednesday on the coronavirus, and a lot has changed even since then. What have you learned in the hearings versus what you're hearing from doctors and scientists worldwide?
Yeah, this is a very fluid situation. What we learned in the hearing, we had a couple of expert epidemiologists sharing things, is while it's okay to quarantine folks and institute a travel ban, it's probably not going to be as effective as folks think it will be. You know, this virus has already spread globally, and it is very hard to contain at this moment. The best things we can do right now is urge the Chinese to allow our CDC officials into China to work at the epicenter to really get ahead and know everything we can about this virus so we can ultimately come up with a vaccine and the best protocols.
So thus far, are you saying China will not allow CDC officials to come in who are volunteering, to take a look at things, to bring their own research?
You know, it's been about a month that CDC's been requesting to go in. We do have some personnel that are going in with the World Health Organization, but we've got to get more of our folks out there. We've got the best epidemiologists, the best scientists in the world, and we've got to figure out exactly what happened with this virus, how it's spreading, and then, there may be a difference between what's happening in China, because you're seeing many more deaths and much more morbidity and illness in China than you are in the cases around the world.
One of the things that you talked about in the hearings was, the dangers of misinformation. And we know now, China suppressed a lot of information. Perhaps they even colored it a different way, based on what the real picture is now. So how concerned are you that, you might not be able to make an impact as it pertains to what information or misinformation might be out there?
Very much. That's the reality of the 21st century now, is misinformation with social media, with the internet, what's true and what's not true. So we don't want to panic, folks. And again, the risk in the United States is relatively low right now, but we do want to be vigilant, and we want to make sure people get accurate information. Look what happens in the anti-vax movement, with misinformation.
One American in Wuhan has died. What are your concerns about how adequately prepared the United States is?
In a bad flu season, our hospitals get overwhelmed. So we're in the middle of flu season right now. You slap coronavirus on top of that, if it in fact does spread in the United States, it'll overwhelm our health system fairly quickly. That's why Congress has asked the administration what they need in terms of emergency funding, et cetera, to make sure that doesn't happen.
Okay.